There is this great quote that says, "Every complex problem has a simple solution that doesn't work." It is especially true when it comes to solving the non-communicable diseases, or NCDs, pandemic. There are a number of interconnected factors behind the global rise in NCDs, like obesity, diabetes, and hypertension. As a result, there is not one straightforward way to stop their spread, but this doesn't mean that there's nothing we can do. I'm Lara Dugas, AXA Chair in Non-Communicable Disease Epidemiology from Loyola University Chicago and hosted at the University of Cape Town. In this third part of my masterclass, I'll discuss some of the main ways we can impact the NCD burden according to its three drivers: the nutrition transition, climate change, and access to healthcare. Because nutrition is probably the main driver, it's also the lowest hanging fruit to tackle the NCD epidemic. It is important, of course, to make healthy food more accessible for all populations. This is currently not the case in many urban and rural places because of food deserts and huge socio-economic disparities. For example, 57% of South African households are severely food insecure. And even if healthier food happens to be available, many people simply can't afford it, and as a result, choose cheaper, less perishable, processed foods instead. How to overcome this, you might ask? Well, one way is with community-led initiatives, like food gardens and shared cooperatives. Another is with nationally sponsored food assistance programs, like free meals at school. Now, while these local initiatives are much needed, a more comprehensive approach must involve food policies. Because if we want people to make better decisions, the very first step is to let them understand what is in their food. This is where food labeling becomes very important, especially in low and middle income countries, because let's not forget that in these countries, many people don't get a chance to finish high school. So labels must be clear and understandable. In short, simple. Let me give you two examples that have proven effective. The stoplight system: red foods, yellow foods, and green foods. And the picture system that Chile adopted in 2016. As of now, 10 low and middle income countries have adopted a warning system, 8 of which are in South America. Another strategy is taxing unhealthy foods. In 2018, South Africa implemented a health promotion levy. What's that? It's a 10% tax on the cost of purchasing sugar-sweetened beverages. It's very efficient since it resulted in a significant drop in the purchase of these sugar-sweetened beverages. People actually consumed 50% less sugar every day. Finally, countries and international organizations can also implement policies that hold the big food industry accountable. For example, by incentivizing investment into healthier food availability and affordability. Now, to counteract the impact of climate change on NCDs, there is no doubt that a coordinated global response is needed for the long-term sustainability of our planet. However, at a micro level, there are several examples of innovative projects that are tackling the impacts of a heating planet. Think about it. When your house has no ability to cool itself, or you don't even have windows, you can't generate a breeze. But what if the roof has the ability to reflect the heat? This is what we are currently investigating using reflective paint in 2 low-income countries. We hope that by making the home cool at night, we will improve people's sleep. Remember, poor sleep is a major risk factor for NCDs. Other examples from the University of Cape Town are an indoor air conditioner made from biochar, which is a form of charcoal, and biosludge bricks, as opposed to the regularly used metal sheets. Finally, we need to talk about access to healthcare. In low and middle income settings, it's not unusual to have multiple colliding epidemics underpinned by a social context. For example, people can have infectious diseases and NCDs at the same time, and of course they make each other worse. So, treating the whole person will take a multi-pronged approach. When I say multi-pronged approach, This means one that not only treats the disease, but also takes into consideration the person's social environment. Let me explain a little bit more. Many NCDs can go unnoticed for a long period of time because there may not be clear symptoms and signs until much later in the disease. Take hypertension, which has become known as the silent killer for this reason. Because of this, screening programs and regular health checkups are really important for the management of NCDs. In South Africa, one idea has been to integrate screening and care for NCDs within the existing infrastructure for HIV testing services. It's a good way to optimize existing resources. Let's sum up. There are several ways to curb and treat the global spread of NCDs by acting on 3 levels: the individual, community, and societal level. First, we can enable people to make better health choices by giving them the information about the food they're eating and taxing ultra-processed food and sugar-sweetened beverages. Second, we can come up with innovative solutions that help houses keep cool so that people can sleep better and in turn reduce their NCD risk. Third, we can invite healthcare systems to adopt a multi-pronged approach that embraces the individual, the community, and the society. The key to combating the silent NCD pandemic is to be vocal about it. Today, this was me sharing some of the key causes and solutions. Now, you can pass on the message, or even better, take action.